This message is from Sarah Astro 99. The person asks, I would like to ask you about muscular imbalance. I'm a 29-year-old man and I've been going to the gym for a few years. When my muscles grow, they seem lopsided. I'm right-handed, my right chest muscle is slightly bigger than my left, while my left lat is somewhat more developed than my right. I looked at myself carefully in the mirror and noticed that my right shoulder and hip bone, ACI, anterior superior iliac spine, are a little higher than my left ones. I've, I also tried to have a view of my back by looking into a hand mirror and my back facing another mirror on the wall. When I relax, I see a small curve of my spine, which goes away when I try to straighten my back. So I guess I have scoliosis, which should have involved some rotation of the spine, and I can see that my right shoulder and left hip are placed slightly more forward than their counterparts. I went to see a chiropractor. After some manipulations, my shoulders and hips seemed better aligned for only a few days, then went back to their pre-treatment states. I kept seeing him for about 10 times, all of which turned out the same, so I gave up. This may sound like a serious problem, but it's not. My x-rays are quite normal, however, it fairly concerns me because I've always wanted a balanced physique. In your opinion, what could this cause? Do you have any suggestions of any therapy, stretching, and or strengthening exercises? Whatever you can feel appropriate. Thank you very much in advance. Well, the problem with this is the must you might want to do actual pictures instead of looking in the mirror, just to see if there's any difference with the shoulders or the hip area. And what I do is I draw, once I take the pictures, I'll take a side, a front, a back, and the other side. So all those, and I'll line them up in a row, so I'll see if there's any difference. And what you can do is maybe even once a week take pictures like that then, just to make sure and see if there's any changes or differences with your posture. And let's say one shoulder is higher than the other, so you're going to have to try to bring it down more, do a lot more stretching to bring that down, or stretch out the neck area too. Let's say the one hip is a little bit higher, so more likely if let's say the one hip is a little bit higher, this is more contracted in here, so the quadratus lumborum area right here is more contracted. Also, muscles right in the hip area too are more contracted too. So you got to strengthen those, and you also stretch those out too, to have it more pliable. And again, you kind of answer your own question about the more muscles on one side, your more dominant side, like the pec and those areas, and that's very common. So the areas that you use more, you're definitely going to have more muscles in those areas. But everybody's body is different. No matter who you talk to, or no matter who you look at, you're going to see difference on both sides of the body. So we're never created exactly equal on both sides, of course. So it is frustrating, but it's reality with that then. Let me see. Yeah, the reason why chiropractor somewhat worked because it helped with the posture, but you got to correct your own posture too. So a great advice would to find like a Alexander Techniques instructor. There's not a lot of them around, but you can check in the phone book or check around, or even Alexander Technique. I think it's .com or .org and stuff, but you can search and try to find them in the United States. But those people are skilled at just posture. So that's all they're doing is look. You're coming in for a half an hour, maybe 45-minute kind of treatment, and they're trying to correct your posture is what they're trying to do then. But that would be more better than the things that you're doing then, so they can show you what you're doing different and what you're doing wrong. Or even some chiropractors, if you want to ask them what areas even have them do a posture evaluation, so they're skilled at doing posture evaluations too. But those are two different options for those kind of things. And scoliosis, it doesn't sound like you're actually diagnosed with that, but sometimes when you're looking at yourself in a mirror, those kind of things, is going to look a little bit different. And some people have like a flat back. That's really common. And sometimes people have too much of a curve in the lumbar. If they have too much of a curve in the lumbar, you need to build up the abdominal muscles to help bring that back some. But too much of a flat back, that typically means a lot of lower back problems. So you even have to do like a rotation of your pelvis forward. So you want to try to give a little curve in your lumbar region. But if it's the opposite way, you have to kind of bring your pelvis forward then. So that's how you're stretching it out the opposite direction. So again, whatever way is going one way, you have to overcompensate it and bring it the other way. So it's just a common thing over and over again. So I hope that helps some, and any kind of comments or suggestions for this person, leave below then, and thanks for listening.